Hey, it's Roberto Miki again, and we've got another great hand question of the week. It's number 24 in our series of questions for medical students, residents, and fellows studying for the boards or in-training exams. Well, let's get right into it. A 22-year-old female presents with a boutonniere deformity of the long finger. Which is the most likely etiology of the deformity? A. Sagittal band rupture at the metacarpophalangeal joint. B. Chronic bony mallet finger. C. Volar plate injury at the proximal interphalangeal joint. D. Old central slip injury. Or E. Rupture of the flexor digitorum profundus tendon. Well, here's your chance to pause the video so you can think about the question and answer the question yourself. Boutonniere deformities are an acquired flexion contracture of the proximal interphalangeal joint. The most common mechanism of injury is an injury to the central slip. The central slip is the insertion of the extensor digitorum communis at the middle phalanx just distal to the proximal interphalangeal joint. Now, it is not sufficient to have just a central slip injury to develop a boutonniere deformity, but it is the start of it. A boutonniere deformity develops after a central slip injury if the triangular ligament which holds the two lateral bands together over the middle phalanx fails, then allowing the two lateral bands to subluxate from dorsal to volar on the or at the proximal interphalangeal joint. So once again, it is not sufficient to have a central slip injury, but it is the start of the boutonniere deformity. Now, there's another similar deformity, which is called a swan neck deformity. A swan neck deformity leads to hyperextension of the proximal interphalangeal joint, which is a difference between the boutonniere and the swan neck. The swan neck causes hyperextension, while the boutonniere causes a flexion deformity. Now, the swan neck also leads to a subsequent flexion of the distal interphalangeal joint. So we're going to depict that in our next two slides. So here on the top is normal, and then you get the central slip injury, which then leads to the triangular ligament failure, then causes the two lateral bands to fall volarly, which then causes the boutonniere deformity. So what you can see in the top drawing is that you have the yellow bones followed by the purple line, which is the central slip or extensor digitorum communis, and then you have the lateral bands being depicted by the light blue line, which start volar on the proximal phalanx and then at the proximal interphalangeal joint end up dorsal and then end up dorsal over the DIP joint, which means that they both extend the PIP and DIP joints but flex the metacarpophalangeal joints in the normal situation. But when you have a central slip injury depicted by the green arrow, there's a disruption of that, which then causes the lateral bands to subluxate volarly when the triangular ligament fails, and then what happens is these two lateral bands, instead of being on top or dorsal to the flexion axis of the PIP joint, end up being volar, and that allows that causes the proximal interphalangeal joint to become stuck in a flex position. But this also causes the distal interphalangeal joint to become hyperextended. Now, this is in opposition or in contrast to a swan neck deformity, where usually the injury happens more distally at the level of the distal interphalangeal joint, causing an imbalance of the lateral bands again, which then causes the tendon to retract slightly, which then causes them to hyperextend the proximal interphalangeal joint as depicted here in this drawing. So once again, the swan neck deformity causes a hyperextension of the PIP joint while causing a flexion deformity of the DIP joint, which is in contrast to the boutonniere deformity, which causes a flexion deformity of the PIP joint and a hyperextension deformity of the DIP joint. So here are the two deformities, so you can see them in contrast. And so it's important to know and just be able to distinguish between the two in order to answer many questions on the boards and in training exams. Now, to explain the other answers, a sagittal band rupture will lead to subluxation of the extensor tendon with flexion of the metacarpophalangeal joint, which often can cause catching, and this catching can be mistaken for a triggering or a trigger finger. But a sagittal band rupture alone will not lead to any kind of deformity at the PIP joint or DIP joint, leading to a any kind of boutonniere deformity. Now, a chronic bony mallet could potentially lead to a swan neck deformity, but would not lead to a boutonniere deformity. C, a volar plate injury can be a mechanism for a swan neck deformity in a rheumatoid patient, but would not lead to a boutonniere deformity. E, a rupture of the flexor digital profundus tendon is seen in a jersey finger, but does not lead to a boutonniere deformity. So the answer is D, an old central slip injury. Well, I hope you learned something. I hope you enjoyed the video, and we'll see you at the next one. Remember to like and subscribe so we can continue to support this channel. We'll see you at the next one.